Today we have with us renowned doctor, endoscopy and colonoscopy specialist, Dr. Rakesh Kalpala. Let us ask him and get more information about diabetes, obesity and the related issues. Hello sir.
Hello.
So first of all, we are very glad to meet you, and most of the times we all feel that diabetes is all about sugar levels, but how the gut health is impacting on the diabetes?
Very important point. So what we think in general about diabetes is because of some problem in the pancreas, some problem in insulin production and all. But directly or indirectly, gut is related to diabetes. Why is it happens is because gut, the intestine has got some substances which are released exclusively in the second part of intestine, small intestine, which are called GLP and GIP analogs, incretins. And now, in fact, if you see the GLP-1 analogs are the drugs which we use in weight loss and diabetes management. So those hormones are specifically released from the second part of duodenum, that is the small intestine. And if there is a something called as a leaky gut syndrome, where the duodenum doesn't secrete these hormones properly, that leads directly to low-grade inflammation, which leads to diabetes, because the endotoxins migrate out and then these lead to impaired production of these hormones, what I talked about, and that will lead to diabetes. So gut health is directly related to impact on the diabetes.
Most of the times when we talk something about gut health, the first thing that comes into our mind and the discussion goes through the gut microbiome. So how important to have a good gut microbiome, and what is the key role that it is playing?
So gut microbiome, in fact, if you see, it's a mind-boggling number of 1 trillion bacteria are there in our gut, and which is impossible to synthesize. So you have good bacteria and bad bacteria. When the bad bacteria dominate good bacteria in the amount, that leads to all these discrepancies. For example, you have this good bacteria like lactobacillus, bifidobacterium, there are some species. When these are depleted or decreased in amount in the gut, that leads to imbalance, which leads to release of some toxins. These toxins go from the intestine and reach into the blood circulation, and that leads to the disparity of this hormonal balance, leading to diabetes, obesity, insulin resistance and all the other metabolic diseases, what we call. So that's the way it's very important.
Sir, in general view, there is this thing that people who are obese, most of the time they'll develop diabetes. But when it comes to the Indians, the people are very low weight or lean also, they are also developing the diabetes. Why is it so?
Yeah, it's a very valid point and a very nice question. In fact, India is the diabetes capital of the world, but not all of us are obese. Even if they are obese also, most of the obesity is around the trunk area, yes, which is called as centripetal obesity. So our body, the upper part is thin, legs are thin, but the middle part is wide, heavy. So that is what is called as, there are different types of fat in the body, visceral fat, then you have the subcutaneous fat. So our visceral fat is basically the fat between the viscera. Viscera means organs. That is the fat in the liver, fat in the pancreas, fat between the intestines. So that is all fat distributed. So our fat is distributed around that centripetal obesity, and this visceral fat will lead to release of these pro-inflammatory cytokines, we say. That is, they produce inflammation. They are pro-inflammatory, so they are friendly to inflammation. And this increase in inflammation leads to release of the toxins, as I said before, into the bloodstream, and that leads to these hormonal changes. So this visceral fat is a culprit. In fact, I always tell my peer group people and all, you develop some drug which directly hits visceral fat. Unfortunately, there is no drug till now. So that is the game changer. And that is what the science is now working on, to do something where you can directly hit the visceral fat.
So as you mentioned about some drug must have come for the visceral fat. Is there any companies or the hospitals which are working on it? Is there any research going on it?
Yeah, so in fact, we are one of the pioneers in the world working on the visceral fat. So our concept is there is an entity called metabolic duodenopathy, which is an evolving entity. So duodenum is second part of small intestine, and there are some change, lot of changes. The duodenum is now considered as the second brain of the body. So entire nervous system, that is, we call it in medical language the enteric nervous system. That means gut and brain. Enteric. So entire enteric nervous system, ENS, is concentrated in the duodenum. So for example, you have these neuronal hormones called serotonin and all, you must have heard of. So earlier the concept was serotonin is produced by brain, but that is wrong now. 85% of body serotonin comes from duodenum. So if you try to manipulate the duodenum by doing some procedures, so for example, I am working on endoscopic procedure where you ablate, that is, you kind of burn the duodenal mucosa. So if you do that, you will have a change in increase in your hormonal production, then the gut microbiome changes, and even this enteric nervous system serotonin production and all increase. So these are the major research points going on, and I am very confident in the next 1 to 2 years we will come up with something which will address diabetes, which will address visceral fat, and which will address obesity.
So we are already doing on that research. So at what stage the research is going on, and when can we expect for the common people to get these kind of treatments?
Yeah, so it's a little confidential. I should not open it out, but because you asked, probably I can say it is in the phase 3, phase 4 clinical trial. We started the recent human trials, and as you know, like science is a slow subject, so it will take at least another 1 year for us to come with positive results, and once we have the results positive, then we will make it a market available device.
So you just mentioned about endoscopy procedures. Most of the times for the weight loss, when people are obese, they go for the surgeries. So what is the difference between the conventional surgeries and these endoscopic surgeries?
Yeah, so again it's a very valid question, because now with the era of drugs, these things are still there, but people want first fast and ready-made therapy. So the difference between endoscopic and surgical bariatric interventions, what we call is surgery wise, they cut or they resect one of, for example, if it is sleeve gastrectomy they cut the stomach and make it small size. And if it is a bypass, then they bypass and then join the intestine with stomach and all. So what we do in endoscopy is 2 or 3 things rather. One, we decrease the stomach size by suturing it with the endoscopy device, which is a daycare, non-surgical, no scar, or put an intragastric balloon. So this is basically to decrease the appetite so that the person who is binge eater will lose weight with these things. Second thing, what I mentioned about just doing in the duodenum is basically more for diabetes and other metabolic disorders. Indirectly, it will also give a weight loss.
So when it comes to the food habits and lifestyle changes, most of the times when we met doctors and we discuss about the diabetes, they'll say that it is completely the lifestyle changes that we have to adopt. But what are the main reasons that are leading to diabetes and obesity, and how these both are interlinked?
Yeah, so there is a term called as diabetes and obesity. So the main reason for this, as you said, lifestyle, of course, sedentary lifestyle is the big enemy, and the foods what we have now. This is a fast food, what do you call, zamana, as well as ready to eat, ready to go. So with our busy lifestyle, so whatever comes in hand, you take it, and they're all fast, easily made ones. So ultra processed food, if you ask me, are the biggest enemy for the human race in this current world. Unfortunately, we are hopping on that. So the fermented foods, the naturally available foods, vegetables, fruits, they have become a small portion, and these have dominated that. And we have to blame ourselves, not anybody. And the food industry also is being driven by these things. So the main reason for diabetes and obesity is this sedentary lifestyle with I don't say unhygienic, but unhealthy food.
Okay. So just a few minutes back, we just discussed about the trunk part weight. Most of the Indians are developing the belly fat. Why is it so? Is there any particular reason to develop those kind of fat particularly?
No, there are multiple reasons. One is genetic, of course, predisposition is one. Second, our body contour is in that way where the fat accumulates more in the central part of the body. Third, of course, lack of exercise and physical activity. So by and large, if you ask me, it is more of our body nature, because if you see the Western population, they have more of subcutaneous fat. They are bulky, heavy, and they have fat distributed from head to toe equally, proportionately. But for us, we are different. Our morphology is different. So probably I would attribute it to genetic as well as the morphological features.
Sir, when it comes to the diabetes and gut issues, recent times we are hearing that GERD cases are increasing. Why is it so? What exactly is GERD?
So I always say, of course, GERD basically stands for gastroesophageal reflux disease. And I always tell everywhere, wherever I go, there is no person on this earth who never had a GERD. That means all of us belch, all of us burp, all of us will have heartburn. Okay. So that happens to anybody who is a human being. So that is so common. The reason why this happens is you have the esophagus, the food pipe, the stomach, and there is a junction between the esophagus and food pipe called gastroesophageal junction. It's a valve. So if the valve is loose or if there is a high acid production, then that leads to reflux. That is reflux disease. But in terms of the subject what we are talking, obesity is one of the main predisposing factors for GERD. We call it GERD. Because when you are obese, there is a lot of pressure from the external fat onto the stomach, and that in turn leads to pressure on the valve, that in turn leads to pressure on the esophagus, that is food pipe. So any person who is having abnormal body weight, that leads to directly this GERD symptoms. And vis-a-vis GERD itself also, what happens is people who have GERD, they tend to eat a lot, because if they have a little empty stomach, the reflux starts coming. So they fill the stomach by eating more frequently, and that when you eat, then that will create a layer in the stomach, and this acid won't come up. As soon as you digest and then the food goes down into the intestine, again you will get the reflux, again they tend to eat. So this is a vicious circle. So that is what is...
Generally we all burp, as you mentioned, we all have some heart burning issue. Yeah. Most of the times, at least a week, once in a week, very common when it comes to the burping. Is it that danger to have such kind of symptoms, or when we have to consult a doctor about these GERD symptoms?
Yeah, so very nice question. In fact, burping and belching is a human tendency. It's a physiological process. It is not abnormal. But when it happens more number of times, that is abnormal. So especially one continuous heartburn, where you feel that burning sensation in the esophagus and somewhere in the stomach, that is one, and which happens chronically, and then you have the symptoms persisting. Second, if you have difficulty in swallowing, so that means that the food pipe has narrowed down. And third, belchings, as I told you, there is no number that you should have 10 belchings only, that is good, and 15 is bad. But if they occur frequently and it is impairing the quality of life, and especially in belching or burps, what we have to understand is when what the food we eat comes up in a very sour taste, which will give you a tendency of some soreness in the mouth, and also that bitter taste or more of burning sensation. So these are the symptoms which you have to be very cautious, and then if you take a antacid tablet and it doesn't subside, then you have to have a attention to doctor. Why? Because the symptoms as such, if it is only GERD, fine, you can take some medications, but sometimes if they are long standing, that might lead to early cancers of the esophagus or the stomach. So that is the one.
Are these GERD diabetes and obesity, these three are interlinked. How much impact does that obesity and GRD having on diabetes, sir?
Very much. So what happens is obesity, as I told you, that is the reason for GERD. Even in diabetes, diabetes is a condition where it directly affects every neuron, that is nerve cell of the body. So there is something called as diabetic neuropathy. So diabetic neuropathy occurs mostly in the lower limbs and they will have the numbness. But diabetic neuropathy also affects the neurons of the other parts of body. So the whole gastrointestinal tract has also got neurons, which we don't generally discuss.
Yes.
So that neuronal activity decreases if there is long-standing diabetes in the form of something. There is a term called gastroparesis. What happens is when the patient is obese or diabetic or both, when we eat food, it usually takes a couple of hours to churn itself in the stomach and then it will go into the intestine. In diabetics or in obesity people, that will stay long. Instead of churning and then getting out in half an hour to 90 minutes or something, it will stay for 4-5 hours there. And when the food stays there without getting down into the intestine, that leads to reflux and that leads to GERD. Simple thing. And obesity, as I told you. So these two are main predisposing factors for GERD.
We discussed about the endoscopic bariatric surgeries and conventional bariatric surgeries, but in these recent times when we see people who are, most of the people are consuming some tablets or the powders to lose some weight. How does those powders and tablets are going to impact the diabetic people who are obese, and when it comes to the normal people also, how dangerous those are those are very healthy to have?
Yeah, so see, basically these drugs what are there in the market now are going to decrease, they are helping for decreasing the weight as well as diabetes control. But what exactly this drug is doing is important. What happens is when you take this drug, that is going to create that artificial gastroparesis what I told. So that will make the food to stay longer instead of getting into the intestine. So that leads to decrease in the hunger and then you don't feel like eating. You eat one meal, after few hours then you get that hunger again because this drug is going to make the food stay for a longer time. So that again leads to GERD. So that's the reason why instead of depending on these drugs, you should have a natural way of weight reduction.
To have natural way of weight reduction also, some people go drastic diets and
intermittent fasting and all.
Those intermittent fastings or the drastic diet changes, how they impact our gut health and the diabetes?
Yeah, so intermittent fasting has now become a little controversial subject. Earlier it was accepted, but now again we only are, so we are saying it's not good for all. The first and foremost is, as one size doesn't fit to all, so no one diet is common to all. Every person, they have to have their own diet according to their body mechanisms. And these intermittent fasting is helpful for some people. I'm not completely denying it. But again, some people, intermittent fasting will cause a little more deleterious effects, side effects, if they are not done properly. Then there is a term called circadian rhythm. So the circadian rhythm of each person varies, and then you should follow the circadian rhythm. For example, you should not have a very late night meal, and early meal is good. Then as soon as you eat, you should not lie down. You should have at least 1 or 2 hours sitting, standing, walking. The new concept now is after dinner, it can be 6 o'clock, 7 o'clock, at least 15 to 20 minutes of walk is mandatory. So these are the new concepts evolving, and as I told you, I re-emphasize again and again, it's individualized. It's not same for you, same for me, or same for anybody else.
So then, as you mentioned, it is individualized. If one person is diabetic and he is obese, then whom he must have to go and consult, and what kind of system he must have developed and adopt? So
this is again a very practical question. Person who is obese and diabetic, or only obese, only diabetic, I always tell have a holistic approach. So if you want to visit, you visit an endocrinologist, they will give you only the medications. If you visit a gastroenterologist, they will give you only those gastric related medications. And a nutritionist will give you only the nutrition part. So it should be a holistic metabolic clinic concept which has to evolve everywhere. And the person who is obese with diabetes should be seen by all means, not only as an individual tubular vision. And if you want to choose the doctor, obviously you cannot have everywhere all these team working metabolic clinics, but ideally in our given frame of options, a good nutritionist and a good metabolic specialist. He or she can be a diabetologist or endocrinologist or a physician, whoever. So these two should be mandatory to have.
Okay. Sir, you just mentioned about walking after dinner. So, but is general walking, sometimes when we go through and we discuss with some people suggest that slow walking is good for the reduction of the weight and fats. And some people say go for the fast brisk walk.
Yeah.
Some says the weight lifting or something,
Yes.
those kind of
Yes.
core workout is good.
Yeah.
What exactly is good for the diabetic people and for the people who are having gut issues also?
So exercise is a very key important factor, and now the concept of exercise is evolving into a next level. So earlier we used to say walking, it can be brisk walking, normal walking, but sometimes brisk walking till you sweat, or cycling, or running, these things, or this cross trainer also is something which commonly people do. So those are all aerobic activities, but equally important is strength training. So there is a concept which is rapidly evolving now called muscle metabolism, because obesity, as you know, there is an entity called sarcopenic obesity. The person looks obese, but if you see his muscle mass, it is totally bad. So that is called as sarcopenic obesity, where your muscle mass is very bad, very low, but you look very obese. So in those people, especially when you start these weight loss drugs or you get these procedures, then they will have a rapid not only loss of weight but loss of muscle mass also, and that leads to very bad quality of life. So strength training is equally important. In fact, now if you say that standard dictum of 150 minutes per week walk and all those, 2 days of strength training, which includes this weight lifting under the supervision of a trainer if you can, or even otherwise, is mandatory, because strength training and the aerobic activities both are important, and the muscle metabolism, if it is doing good, that leads to a positive effect on your diabetes control as well as weight loss and obesity also.
So finally, what the message you want to give for the viewers who really want to adapt a good lifestyle to avoid type 2 diabetes and who want to live a healthy life?
So in a nutshell, what we discussed, what I would like to put upon is, in fact I would add a little more. Lifestyle changes include good healthy food, balanced diet, more vegetables, fruits and fiber diet, then less of the carbs and processed foods, and more important is the circadian rhythm, what I spoke about. Sleep is very, very important. The sleep cycle is now center point of metabolic control. So the better you sleep, the better is your metabolism. And physical activity, which we already touched upon. So it should be a disciplined lifestyle which includes lifestyle modification, food habits under control, sleep rhythm under control, and a positive frame of mind, which is at the end of the day, you might be earning millions and trillions, or you will be struggling to get some job, but if your mental health is good, your physical health will be good.
Thank you, sir. Thank you so much. So this is all about how metabolic issues are impacting diabetes and how obesity and endoscopic procedures are helping to reduce obesity and insulin resistance.